Hey there, I'm Dr. Jason Kim from New York Dental Solutions, and welcome to our YouTube channel. For those of you that haven't been subscribing or haven't followed our YouTube channel, welcome, and hopefully you'll continue to join us for our content, continue to follow us and subscribe to us. And so hopefully you're all doing well. It's the heart of winter here in New York, and it's cold. Today it was about 15 degrees Fahrenheit, which is about minus 10 degrees Celsius in other parts of the world that use the Celsius scale. But before I left, I wanted to share a little bit of content, because as I was outside, because it was so cold, my teeth were a little bit sensitive because the cold air came and hit a couple of my teeth and it caused some sensitivity issues. And so I wanted to kind of bring that to the audience and ask the audience, how many of you have sensitive teeth? And many of you, I'm sure, are gonna raise your hands. And so, why do you get sensitive teeth? Why do you get sensitive teeth when you drink cold waters, cold sodas, ice cream, any cold foods, or even fruits and vegetables that may be acidic in nature? That's gonna cause some sensitivity for those patients. And so what are some reasons we get sensitive teeth? One is, if you scrub and brush your teeth very, very hard, you're actually causing more damage. You're gonna wear away the outer surface of the teeth, and what happens is that inner layer gets exposed, and that's what causes sensitive teeth. So make sure you use a soft toothbrush, preferably an ultra soft or extra soft toothbrush, because you don't need to scrub that hard. So make sure you use a soft toothbrush, you're not scrubbing, and that's gonna minimize getting sensitive teeth. Another reason why we get sensitive teeth, why people get sensitive teeth, is people who clench, who grind. They get these areas of the teeth that are worn away, that are notched out. You get these indentations in the teeth. And so those areas, if we blow air or if we touch it with a metal object, it's gonna cause sensitivity. And what you see a lot of patients, if we touch those areas, they jump and they go, oh, that's a little sensitive, uncomfortable. And so people who scrub their teeth, brush their teeth very hard with a hard toothbrush, over time will wear away teeth. Patients who are more prone to grinding or clenching their teeth will get areas of teeth that are worn away. And those worn away areas is what's causing the sensitivity. So how do we correct the sensitivity issues? How do we get rid of the sensitivity? Well, one is by doing what we call a bonding, a tooth-colored filling to cover the surface of the area that's been worn away. So we can cover it up to protect it so it doesn't cause sensitivity. So anything like ice cream, cold sodas, cold drinks, cold foods, well, anytime you eat those things, it can be very uncomfortable. And if we can cover those areas, then it becomes much less sensitive and much more comfortable to be able to enjoy the foods and drinks that you like. Another way to treat sensitive teeth is to cover those areas with gum tissue. It's a surgical procedure. Yes, I know most people don't want to do surgery, but that way we can cover the sensitive teeth without having to do any bonding. We don't have to prepare the teeth. We don't have to put any fillings there. We won't get the teeth that's going to continue to maybe recede, meaning get lower and lower. We can cover the area of the tooth that's been exposed with some gum tissue, or we can raise the gum tissue up. That's a surgical procedure. So that's another way to help treat sensitive teeth. The third way, which is probably the most easiest recommendation, is using sensitive toothpaste, meaning toothpaste that's going to help prevent or minimize the sensitivity issues. Here in the United States, we call it Sensodyne, or there's a toothpaste by Colgate called Colgate Sensitive that helps limit or minimize the sensitivity issues. Another way we can combat the sensitivity is we can prescribe a toothpaste. It's a prescription-based toothpaste that we can send to the pharmacy that will help prevent and minimize those sensitivity issues. So hopefully with this episode today, we can help you minimize some of those sensitivity issues by either using a toothpaste, covering the tooth exposed areas with the bonding, or a surgical procedures, so that way we can minimize those sensitivity issues. And for those of you that are suffering from sensitive teeth, hopefully you can correct it soon so that you can enjoy your cold drinks, your ice creams, and especially in this holiday season, you'll be able to enjoy those precious moments with your friends and family. So everyone, thanks for joining. Continue to follow us, like us on our YouTube channel, and enjoy the happy, healthy holidays. Bye-bye.